three tenets to a smart exchange: competition, transparency, and something that we call team-based care. And team-based care is really doing things better than we've done them in the past. One of the tenets of team-based care is that everybody works together. We don't work in silos. We have health professionals, physicians, medical assistants, nurse practitioners, physician assistants, community health workers, all working in tandem with one another, all working at the top of their licenses to make sure that the patient gets the best possible care. How do we do this? Number of things. We have electronic health records that work and are practical. We make sure that language and culture is addressed, make sure that people who may show up at a healthcare facility that don't speak English have the kinds of services, the kinds of sensitivity on the part of the people working in those facilities to make sure that their healthcare is the best that it can be. But we also make sure that that team is reaching out into the community, that it's not just a doctor in an office, but it is a team. Also involves the use of something that we call registries. Registries for certain types of patients are very important. So, for example, a diabetic patient, to make sure that if they have a high hemoglobin A1C in their last visit and they haven't been seen by that team in a number of days, that somebody on that team, a nurse, a medical assistant, reaches out to that individual to find out how is their hemoglobin A1C? Why haven't they come back in? Is it because everything is going well, or is it because there's a problem? Only in this way can we make sure that we address the real healthcare problems that really haven't been addressed in the previous system. Only in this way can we actually improve quality, have better outcomes, and contain the costs that have been running rampant in our healthcare system. We want the exchange to work, just as the exchange board and all the great staff that work at the exchange want to make sure that it works. But we're bringing this piece of the puzzle to the table because we think that it's an essential ingredient which people don't ordinarily look at. There are lots of pressures in the system to not go with a team-based system, to not go with a smart exchange, to keep doing things as they have been done, because that's what people know. I think the challenge of our coalition is going to be to bring that message, to make sure people understand why this is so valuable, why it has worked in other states to contain healthcare costs and to improve quality, and to make sure that California isn't the last state that adopts this.